Hi, my name is Dr. Alsherbini, and I'm presenting to you this case in recognition of Epilepsy Awareness Month. Status epilepticus is a medical emergency. A lot of status epilepticus presenting to the emergency department, they have an acute etiology. One of the most common is epilepsy patient presenting with status epilepticus due to various reasons, like missing their medications or having an acute infection. Immediate recognition and treatment is the key success to have a huge impact on the outcome of these patients. This is a case where a point-of-care EEG in the emergency department has huge impact on the outcome of this particular patient. This is a 63-year-old male who has a history of epilepsy on phenobarbital at home. He was recognized by his sister that he was altered and confused and brought to the emergency department by EMS. And there was a concern of seizures because this is typical what happened when he has seizures and was definitely not at his baseline. Sister mentioned that he was taking his seizure medication. He did not miss any dose, and initial workup and his basic labs in the emergency department were within normal limit. Now, normally these situations, when you are in the emergency department, the way it works, you consult neurology. Neurology comes and evaluate the patient. They order the EEG, and it's usually, for the best case scenarios, takes a couple hours before you are able to get an EEG. And sometimes it's very hard to get EEGs in the emergency department because you have to bring these bulky machines, and as you know, ER is always busy and patients are moving in and out. Now, when you have the availability of a point-of-care EEG, this patient was placed on the point-of-care EEG within 3 hours of his presentation. Basically showed immediately the seizure burden was high, and it showed that the patient was in status epilepticus and was treated immediately. This patient was, as you see, received multiple medications, including midazolam, as well as a levetiracetam load, and finally phenobarbital, and we're able to treat his status epilepticus, and his seizure burden came back to zero, and we were able to monitor him on the point-of-care EEG for up to 8 hours with no seizures. This has a huge impact because sometimes getting the EEG is difficult, and also getting monitoring of the EEG is challenging. This patient had no further seizures. His exam continuously improved. He was back to his baseline and was able to be released within 24 hours of his presentation. And if you imagine that this patient did not have access to this point-of-care EEG technology, you will see that most likely what happens is getting an EEG in a delayed fashion, and usually his seizures can be refractory and very hard to treat, which might result in putting him in an intubation and ICU setting, and sometimes treating these refractory cases can lag for days and sometimes weeks on end. So the impact where we see this technology of point-of-care EEG enabled the prompt detection of suspected non-convulsive status in the emergency department, as well as its real-time monitoring of the patient response to medication, which allow rapid escalation even in the emergency department, with the ability to recognize the impact of those medications on treatment using the seizure burden. Obviously, this will have a huge impact on outcome for these patients, like patients presenting with status who gets treated in the ER and discharged the next day, versus a patient who comes in with status who needs to be intubated and spend days to weeks in the neuro ICU being managed for refractory status because of the delayed recognition and delayed treatment. Thank you very much.